Good afternoon, everyone. I am Sarah Rosen Wartell, and I'm the president of the Urban Institute, being brought to you from our front lobby due to the magic of Zoom, although really my second bedroom. First, let me provide a couple of housekeeping notes as people get on. This event is being recorded, and the recording will be posted online after the event. All participants are muted by us. If you have questions, we encourage you to type them into the questions box at any time. And if we have time at the end of this session, we will answer them. If you'd like to join the conversation on Twitter, we encourage you to use the hashtag #LiveAtUrban to join with others. Second of all, I want to say that I hope all of you are well and those you care for are as well. For the Urban team, we are encouraging people to first and foremost take care of themselves, but after that to turn to our mission, which is bringing forward evidence-based knowledge to help policymakers make decisions to protect vulnerable families, communities, and our economies, especially at times like now. And we're trying to work on three sets of problems simultaneously: our country's response, the recovery, both health and economic, that must follow, and long-term resilience. Because while we like to think that crises like this one are 1 in a million, with global health, economic, climate, and other shocks, we also need to be looking hard at how to build the kind of inclusive society where everyone is better protected from the unexpected, even while giving everyone the opportunity to make a better lives for themselves and their families. So today's topic is a perfect one for this quick news series. This is our second episode where we bring together urban experts and various change makers to discuss solutions for the short, medium, and long term. Today's topic is whether federal relief, in many ways our most immediate response, can lead to quicker and stronger recovery and greater resilience if we consider now the conditions and circumstances in which it'll be time to turn that relief off. The CARES Act and the earlier Families First Corona Recovery Act provided expanded unemployment benefits and many different types of aid to both individuals and state and local governments, but the assistance is largely time limited, designed in hopes of a quick reopen and bounce back. And even since the passage of those two laws, we've learned a little bit about the likelihood for how quick that bounce back will be. With key provisions ending as early as this summer, while the need may still be great, we could conceivably prolong the hardship and delay recovery itself if we turn these switches off too soon, and that's our topic. I'm pleased to be joined by Sharon Parrott. She is the Senior Vice President for Federal Policy and Program Development at the Center on Budget and Policy Priorities. She recently served 2 years as what we call a PAD, or the Associate Director for Education, Income Maintenance, and Labor Division at OMB. Tracy Gordon is a senior fellow here at Urban and a leading expert on state and local finance associated with the Urban Brookings Tax Policy Center. She came to us from the White House Council of Economic Advisors with career stops also at the California Public Policy Institute. She's currently a member of DC's Infrastructure Task Force and was its Tax Revision Commission. Both Sharon and Tracy have been drawing upon lessons from the Great Recession and writing about their concern that relief should expire neither too soon nor too late. Specifically, let me just point you to these things for more information. Sharon and Chad Stone published a piece available on the Center on Budget's website, descriptively entitled Labor Market Conditions Should Determine the Duration and Size of Relief Measures. And Tracy has published on Tax Vox about the kind of support that states and localities need from Congress, which she'll talk about more here today, and also published a 2018 paper with the Hamilton Project on how to make our intergovernmental system more responsive to the state and local fiscal needs. Together, we're going to look at how we might instead approach this set of problems with automatic stabilizers, and whether policymakers should link state local relief, unemployment benefits, SNAP benefits, and other benefits to economic conditions rather than specific dates. So to start, I'm going to ask you, Sharon, to please describe the kind of the support that Congress has so far provided to individuals, families, and businesses, and then we'll ask the same of you, Tracy, to describe the relief to state and local governments for health, education, and direct fiscal stability. Sharon, why don't you start?
Thanks, Sarah, and thanks to the whole Urban team for putting together this session today. There have been several relief packages that have passed so far. The two largest are the Families First Coronavirus Response Act and the CARES Act. And between them, they have put in place some really important and pretty forward-leaning kinds of assistance to individuals. That has included one-time stimulus payments. Those are the $1,200 for adults and $500 for children payments that has been lots has been written about. I will just say that they are larger and go to a far broader group of people than prior efforts to do direct payments. The second is a sizable expansion in unemployment insurance or unemployment benefits for people that have lost jobs. And the expansions have been in three areas. Expansions in eligibility, so more workers affected by the economic fallout can get benefits in the first place, higher benefits through a federally funded benefit expansion, and additional weeks of benefits. The third are some increased SNAP benefits that were in the Families First bill, though they do not reach, that expansion does not reach some of the poorest households in SNAP. And the fourth is the Paycheck Protection Program, which has provisions that provide loans that are then forgivable to help small businesses retain some of their workers. The thing to note about each of those, though, is how quickly they turn off. So the one-time direct stimulus payments are one time. Expanded unemployment benefits, the expanded eligibility and additional weeks go only through the end of December, and those additional benefits to make benefits more adequate ends in the end of July. The increased SNAP benefits are only in place for the duration of the public health emergency, not for the longer economic fallout that's almost sure to be in place. And the Paycheck Protection Program relates to payroll protection through June. So these are very short-term measures, and the big question in the next package is whether we do things that last throughout the full economic fallout period.
Can I just ask you quickly to add, Sharon, there is a package that the Senate passed yesterday, the House is expected to pass today. It adds more money to the Payroll Protection Act you described. Does it have any other provisions relevant to this?
No, there are pieces in there related to testing and related to hospitals, but the big package relates to the small business loans.
That's great. Okay, so Tracy, same question about state and local support.
Right. I completely agree with what Sharon said, that really the way that Congress has conceived of this so far is sort of as a public health emergency more than a fiscal emergency for state and local governments. So the actions are big, they came quickly, but they're really short term. There are four main buckets. The first act that got passed in the beginning of March appropriated about $1 billion for state and local governments, mainly for the public health response. The Families First Act that you referred to included a bump up in the federal matching rate for Medicaid, the rate at which they match state expenditures, of about 6.2%. But then critically, as Sharon mentioned, the aid was tied to the public health emergency declaration by the Secretary of Health and Human Services, which is not necessarily in sync with states' fiscal issues arising from this crisis. The third main congressional action, the CARES Act, included a coronavirus relief fund, which appropriated about $150 billion, of which $139 billion would go to states and the rest to local governments. But again, that was for expenses incurred to fight the coronavirus that were not already included in their budgets and that were incurred by December 2020. There were also grants to transit agencies, which has been majorly impacted by this crisis. There was about $30 billion for education, split evenly between K-12 and higher education. And then critically, the CARES Act also gave about $500 billion for loans and loan guarantees to businesses and state and local governments. About $35 billion of that has gone to set up something called the Municipal Liquidity facility at the Fed. That's so that the Fed can buy short-term notes, which state and local governments normally issue to bridge gaps between money coming in. States with income taxes, for example, get about 15% of their personal income tax revenues in April. And of course, that's not happening now because of extensions of filing deadlines. So the Fed is going to buy short-term notes that states and localities might have difficulties issuing. But really, that's only for notes that are for 24 months, which is a help. And issued by the end of September of this year. and of course, their debt that has to be repaid.
All right, so let's talk about, first of all, let it be noted that's incredibly important assistance that will mitigate hardship for individual families and people, and our policymakers should be commended for acting as quickly as they have in a really unprecedented situation. That said, I think each of you have concerns about the duration in particular of that assistance and the longer term effects of the crisis. So Sharon, do you want to just talk a little bit about what the problem that you are worrying about now might be?
Sure. So I absolutely agree that these are very big and important steps that have been taken. Certainly on the unemployment insurance side, we've seen that there have been implementation rubs that people are still waiting, but that's starting to open up. So I think the real question is, now that we've gotten some things in place for this immediate crisis, how do we put in place policies that will serve both individuals and the economy well throughout the entire period where we have elevated unemployment? And we should be clear, right? We don't really know what the shape of this recession will look like. We don't really know how quickly unemployment will rebound. There are people out there doing projections. Goldman Sachs' latest projection has unemployment peaking at 15% nationally. They actually still project a pretty quick growth in GDP, but they have unemployment remaining elevated all the way through 2021 and into 2022. So now that we've gotten some emergency pieces in place, I think the real task is for policymakers to take just a half a step back and think about, how do we put in place mechanisms that will remain in place until we really have seen the labor market improve. And the reason it's so important for that to happen automatically is otherwise we can have lapses in things that are important for people and to boost the economy. And at some point we could see a political problem where it's difficult to continue to secure votes for extension after extension. And so at this point, we have the opportunity to think carefully about not how long with a date certain, but what are the conditions in the economy that would mean we could turn some of the recovery and relief provisions off.
All right, so I'm going to come back to both some of the challenges with this process and some of the potential solutions and those mechanisms. Before we do that, Tracy, talk a little bit about this from the perspective of a budget officer in a state or local government, and what this sort of short-term relief helps them with and what problems they're still facing.
Right, and I don't want to minimize, again, this is a significant down payment on the kinds of relief that states and localities are going to need. But you basically have flipped the switch and turned off the economy. So we don't have the kind of consumption that normally undergirds sales tax revenues, and those are about 23% of state revenues. They may come back, but of course this is a service sector concentrated recession. So it's not as though when the economy comes back to life, I'm going to go out and consume 2 haircuts instead of the one that I would normally get. So I think states, we have not seen it in the data yet because there's a lag between the time that the retailers collect sales taxes and they get to the state revenue collector. But states are very worried about declines in sales taxes and of course personal income taxes for people who are employed in hospitality, retail, leisure sector industries, and then the knock-on effects for the stock market. The California legislative analyst has a tracker for withholding payments for personal income taxes, and they're about 20% lower than you would expect at this time of year, which is also lower than they were in 2009 in the depths of the Great Recession. So I think New York's governor called the revenue loss incalculable. Pennsylvania's governor has already laid off people and is talking about suspending pay for other state workers. So states are very worried about the revenue effects. And on the spending side, you have more people who are using public programs who will probably be enrolling in Medicaid. And so the Medicaid help so far certainly helps. But researchers have calculated this rule of thumb that a 1 percentage point increase in the unemployment rate results in about a $45 billion budget gap. So based on that historical relationship, we would expect budget gaps on the order of $500 billion, which is very similar, if not greater than the last recession. Of course, we don't know if those historical relationships persist given the unusual nature of this recession.
So just two quick additional facts, if you would, Tracy. So the first is states have a different mechanism than the federal government. They don't have the ability to spend infinitely with the hope of confidence in the fisc. Many of them built up rainy day funds, but maybe not commensurate. So can you chat about that for a second?
No, thanks for reminding me of that. I always assume that everybody lives in my world and follows these things closely, but states had their highest nominal reserves on record going into this, about 8% of general expenditures. But really nothing could have prepared them for a hit like this, and especially so quickly, right? They didn't have time to see it coming and to prepare even further. So California, for example, had $20 billion in reserves, and now it's looking more like about 14 already. And then, as you mentioned, states are subject to this kind of 1-2 punch, as some people have called it, that during downturns, their revenues go down just when there's demand for services. And most states operate under a balanced budget rule. We have some great resources on our website about how those rules vary, but a lot of states prohibit carrying over a deficit from one year into the next year. It's also just difficult to borrow for operating expenses. Investors generally don't want to provide revenues or to buy bonds to do that.
So I want to ask each of you to talk a little bit about, even before we get to the mechanisms and the political economy questions, just talk a little bit about lessons from the Great Recession. Tracy, I'll start with you. One of the things that happened, for exactly the reasons you just described, is states had to cut their spending at exactly the very time when the economy was weak. That had consequences for the recovery itself. Do you want to describe those? And then I'll ask the same question for Sharon.
Yeah, so I feel like, we've seen this play before, that basically during the Great Recession, policymakers did a lot. They provided about $280 billion that flowed through state and local governments, of which about $150 billion was this flexible fiscal relief that leaders could deploy in the way that best suited their needs. The problem is that that aid was concentrated in 2009 and 2010, and really state budget gaps persisted into 2011 and 2012. States do the easy things first, like anybody. And so one-time solutions like selling off assets, Arizona famously sold its capital and then leased it back because that provided revenues in the short term. And you can understand why they would do that, but that doesn't solve the problem year after year. So the federal money dried up. State and local governments still had these deficits. They resorted to tax increases and spending cuts across the board in the areas that states generally spend in education and healthcare and human services and higher education. And so, those are concerning because of the real hardship that they create, and also the investments for the future that aren't happening any longer. From a macro perspective, state and local governments also were a drag on the national economy for every quarter but one between 2009 and 2014. And investment in infrastructure never really recovered before this latest recession hit.
All right, Sharon, same set of questions. Lessons from the Great Recession?
Yeah, so there's several. One is that the overall amount of stimulus we did was too small. But the other is that we turned it off too quickly. And in doing that, we both sort of increased human hardship, just the struggles that people had, both because some relief measures were turned off and because by turning off and actually going into an austerity mode too soon, we also lengthened the period of labor market slack. We deepened how much unemployment there was for how long. So just a couple of examples of that. As Tracy said, we stopped the increase in the federal share of Medicaid funding in the middle of 2011, and unemployment was at 9% at that point. We did less on unemployment benefits than we have done in the CARES Act for sure. We didn't do as big of an eligibility expansion, and we did a much more modest increase in benefits. But even that modest increase in benefits was turned off at the end of 2010 when the overall unemployment rate still stood above 10% and the Black unemployment rate was above 15%. We did keep additional weeks of unemployment on for a longer period of time to the end of 2013. There were several lapses, however, because they couldn't muster the votes. It became very contentious when unemployment was still elevated. And at the point that we turned it off, the Black unemployment rate was still above 12%, and more than a third of the unemployed workers we had were long-term unemployed. So we still had significant labor market slack, and even those additional weeks turned off. So I think the big picture lesson here is that we have to be robust in the overall envelope, but we can't turn it off too soon. The last thing I'll say is for those with good memories, they'll remember that 2011, and again, unemployment rates overall nationally were still in the 9% range, was when we started to hear a lot about deficits. And when we started down the path of the Budget Control Act, we had a whole drama around the debt limit. We passed the Budget Control Act, which was a contractionary posture that again worsened the slow recovery from a labor market perspective that we were still in.
All right, so I want to cover two more big topics. So first of all, I want to sort of talk a little bit about the way Congress is approaching this now. We heard a debate yesterday with Senator Schumer saying, we got more work to do. Let's get to go on the next package and the next package. And Senator McConnell saying, maybe it's time to take a pause and see where we are here. But in any event, you can imagine a series of periodic discussions about policy, just like we had in the period you were describing, Sharon. What's right and what's wrong? Why doesn't it make sense to sort of wait and see what conditions are before you do that? I'm going to ask each of you to describe what is problematic and what makes sense about that approach. And then finally, we'll come back and kind of close with your recommended solutions. So Sharon first.
Great. So I think the problem is the uncertainty, and the uncertainty is a hindrance on multiple levels. The uncertainty makes it hard for states that implement many of these programs to plan. We've seen the difficulty on the unemployment insurance program of getting the changes in place. The last thing that they want to do is get the changes in place, have them lapse and have to revert back. Maybe they get extended and now they're going back to programming in COBOL apparently. So there is a implementation piece to this where being clear about how this is going to proceed will make it easier to implement. But the bigger issue is that we just don't know when these measures should turn off. We don't know what the trajectory of the recession will be. We know that when unemployment is elevated, people need additional help, and that there is a great risk that that help gets turned off too quickly if we don't have a policy in place that keeps it on without repeated need for votes in Congress until we reach some benchmarks of the labor market recovering. You know, the politics of this, just the reality of how Congress works, is that it can be quite difficult to get repeated coalitions to vote over and over and over again for a set of policies, and that the same way we don't vote over and over and over again for who should be eligible for Medicaid, for example, we should think about what policies do we want in place while the economy is weak and people are struggling, and put them in place and not have them subject to what could be a particularly turbulent political moment over the next 12 months.
Tracy, thoughts about the consequences of uncertainty for states?
Yeah, I think that all of the same arguments go for states as well. And one thing to remember about the Recovery Act and what's been done in the Families First Act so far is that it's incredibly fast to use the Medicaid program to get money to states. It gives them money, and it also coincides with the need for more spending in that area as people become unemployed and need more healthcare that's not provided through their employer. So with the Recovery Act, the aid went out the door within weeks of their signing the bill, and it was retroactive to October of 2008. So it was incredibly effective. It did turn off early, and there was all sort of angst among the states as this cliff was approaching. So I think that the lesson from that is basically to have these automatic triggers to provide that certainty. Looking back again for people with long memories, the federal government did a lot of stimulus in a piecemeal fashion after the Recovery Act. Really, it totaled about the same amount, about $700 billion, but it came in these drips and drabs. And I think that prevented, business leaders, individuals, as well as state and local governments from having the confidence that their elected officials were taking care of this problem.
And that lack of confidence then maybe slows the larger economic recovery and makes the size of the problem larger, which is, I think. So I want us to close with each of you just 2 minutes. We do have a question about, or maybe you can answer this in the context of your closing, Tracy. The question is about whether there's any talk of bumping up the federal Medicaid match, the FMAP, anymore, or in doing more about the to try to expand the population eligible. Obviously, we're learning a lot about the benefits of Medicaid expansion in the states that have already done that for their ability to absorb this kind of shock as well. But so see if you could answer that, but also just sort of close with a clear statement, if you would, about how you would design the different policy interventions each of you have been talking about. What is the amendment you would have them pass, and what is the trigger that you would suggest? So Sharon, why don't you go first, and then Tracy, we've got 3 minutes.
Great. So I think there are several relief measures that should be tied to the economy. Tracy will talk about fiscal relief, an increase in the SNAP benefit as well as the unemployment expansion. Those are 2 relief measures that get to broad groups of people, are well targeted to people in need, and are important enough to be kept on until the labor market has significantly recovered. So what do I mean by that? We would want to keep those policies in place, both SNAP and unemployment insurance expansions, until unemployment is clearly falling. So we have, measured on a moving average basis, since we have a wonky group with us today. We would want to see the national unemployment rate falling for several consecutive months. We would want to see its level close to, not necessarily all the way back to, but close to pre-crisis levels, maybe within 1.5 or so percentage points, so that we clearly are in both a time when the labor market is improving and that we are close to pre-crisis levels. The third thing I would say is that should govern sort of the national policies. But for unemployment insurance, we know that recoveries do not affect all states equally and on the same schedule. So you can also keep on some of those policies based on state unemployment rates as well. So that you might say, well, the national economy really is in pretty good shape, but in most states it's in pretty good shape, but we have these pockets of states that continue to have elevated unemployment. We could keep those on there.
All right, and Tracy, from you?
Yeah, I mean, as you mentioned, there's obvious trade-offs between having things on a discretionary versus automatic basis. But even before the crisis, people were suggesting this was a good idea to do things automatically. Matt Fiedler and Jason Furman and Wilson Powell had a proposal that for every percentage point increase in unemployment, there should be a roughly 4.8 increase in the federal matching rate for Medicaid. Tim Bartik out of the Upjohn Institute has an amendment to that, pointing out that local governments have budget gaps as well that are caused by recessions. So I think there are a number of design issues. As Sharon already mentioned, there's a question of whether you should look at national versus state level indicators for timing, also targeting, meeting federal objectives in terms of targeting specific populations and sectors that we might care about. So there are a number of considerations that have to be weighed, but I think the point is to do it when we have some time and some foresight and not be making policy in the heat of the moment.
Well, listen, my sincere thanks to both of you and to those of you who've turned in. I would make a personal case in my own area that there's another major element of stability, which is the housing market that we learned in the last recession, that when it's fragile, it makes it very hard for the other key economic indicators to come back. And we are seeing enormous challenges, not only in the mortgage servicing, but especially for low-income populations who are simply unable to pay the rent. And what that's going to mean for the availability long-term of affordable housing is another area. And if you tune in to one of the upcoming Evidence for Action sessions, you'll hear a couple of our experts come together to talk about that topic as well. Also, perhaps one that automatic stabilizers are worth thinking about. In the meantime, thanks for joining us, and thanks to Sharon and Tracy. Be well, everyone. We'll see you soon.
Thank you.